February is Black History Month, and this year we have new data about cancer in the Black community. It is the second leading cause of death for Black people, and according to the American Cancer Society, there are significant differences in the mortality rate between races. Black women are more likely to die from breast cancer than white women. Black men are more likely to die from prostate cancer than white men. This is maybe the most important data point. Survival is lower in Black people than in white people for almost every type and stage of cancer. Dr. Curtis Henry from the University of Colorado Cancer Center is joining me now to talk to us about the factors driving this inequity. So first and foremost, thank you for being here. I know how busy you are.
Thank you for allowing me to be here. It's a pleasure.
It's an important topic, and the research describes barriers in prevention and detection and treatment. What are those barriers?
I think the barriers are multifactorial. Obviously, the one that's probably most common is the financial barriers that can impact a person's ability to, for example, not go to work one day as opposed to going to see their oncologists. One barrier that also is very impactful is regional. So if you look at the data, people from rural areas tend to actually have higher incidence of cancers and also higher mortality rates. And so just even getting to the doctor could be a barrier. The American Cancer Society has addressed that in the context of providing infrastructure that can actually overcome those barriers in terms of providing stay as well as transportation. And then the last part, and again, this is multifactorial, access to education is one. There's programs both through the University of Colorado Cancer Center and those sponsored by the American Cancer Society that tries to address the disparities in terms of education and access to resources. And so those are kind of like the three top areas where these disparities actually stem from.
And would you describe these disparities and inequities as systemic racism?
So I think that definitely racism plays a factor, just like any other complex situation. It's multifactorial. We know about Tuskegee and the medical history associated with that. We also know about the disparities in terms of representation for our healthcare providers, looking at professors, looking at clinicians, looking at clinical trial enrollment. And so again, those are multifactorial questions where you can't root out racism, given the history of this country. And so again, it really is a call to action for everyone to kind of look internally and try to figure out how do we promote equity across the board, because if one group is impacted, all groups are impacted.
Beautifully stated. And you said call to action. I think that's very, very powerful. What needs to change, in your opinion, in the medical community? You're ingrained in it.
Yeah, so I think it's important to have dialogue. I think what we see just across the board in America is people have forgotten to speak to each other and have candid conversations. We tend to kind of want to run away from topics that could potentially be controversial, but this is not a controversial topic. This is a human rights topic. This is an American topic. This is a topic driven by data. And so I think conversations with all communities surrounding what needs to be done, not from our perspective, but from the community's perspective. I think getting that input from the community, taking that back to the Cancer Center, taking that back to great organizations like the American Cancer Society will go a long, long way in terms of reducing equities across the board, particularly in the spaces of cancer.
Well said. And what should people do today? People watching right now, what should they do right now to keep themselves healthy?
Well, the first thing I would say is, be honest with yourself, be mindful. We all have rooms of improvement. And so diet and exercise are the lowest kind of barriers that you can, or hurdles that you can overcome. So, just being mindful of your lifestyle choices, smoking, drinking, all of those things are associated with increased cancer risk and also poor cancer outcomes. And so just monitoring your behavior. I think being educated in terms of if you feel like you need to reach out to a healthcare provider, do so. We're living in a technological age where you have access to the internet or a phone of some sorts. Use it. Everyone at the University of Colorado Cancer Center would love to speak with anyone who has a question. And we have infrastructure in place, regardless of what language you speak, to be able to give you the information you need. So I think just being knowledgeable as best you can, taking advantage of the wonderful state of Colorado and all the access to exercise and great food options we have, just kind of being mindful of those things. And then I would say definitely as a person of African descent, African American, it's very important to go to the doctor, get checked up regularly. For people who have a history of cancer in your family, screenings are very important. We have a CPC office at the University of Colorado Cancer Center, and we've changed the landscape of lung cancer in Colorado based on this very aggressive screening campaign. And so again, the power of screening is undeniable.
Preventative medicine is the
Yes.
best medicine. Dr. Curtis Henry from the University of Colorado Cancer Center, thank you so much for your insight today.
Thank you so much for having me.